Hello everyone, and welcome to the Imagining Innovations webinar series. I'm today's host, Janus van As from the Department of Family Medicine, and the title of today's session is Checking the Facts, Authenticity, Innovation, and the Media in the Wake of a Pandemic. So just before we start, just a few housekeeping rules. We are recording the session, and the recordings would be available at the end of the session on our website, and you would be able to submit your questions to the Q&A section. Now, I think this is such an important session, as the WHO mentioned that one of the 10 greatest threats to global health is misinformation. And misinformation is one of the bigger contributing causes for vaccine hesitancy in South Africa. But I don't think misinformation is an issue just for vaccines, as we are plagued by misinformation on a daily basis through WhatsApp, Facebook, Instagram, TikTok, websites, and basically everywhere that anyone can generate and publish content through, writing and making videos. In order to address the questions about why is this happening and how do we slow the deception, we are joined by two speakers, Dinesh Bhalia and Kate Wilkinson, and they will share their reflection and begin to project us into a future of innovations emerging from the pandemic. Dinesh is the acting director of the Wits Center for Journalism. She completed her PhD in 2020 in journalism and media studies, and she is the former Deputy Public Advocate of the Press Council of South Africa, and is currently the chair of the board of the Health e-News service, and is on an advisory committee as a member of the South African Media Innovation Project, run by the New York-based Media Development Investment Fund. And she is a member of the editorial advisory committee of Newsroom Africa. Dinesh also considers teaching and mentoring to be a contribution to the development of South Africa. And if I can quote her, she said that I can't see myself doing anything else. Teaching is who I am. Dinesh is joined by Kate Wilkinson, the Chief Deputy Editor at Africa Check, and Kate joined Africa Check as a researcher in 2013. She leads the organization's work on artificial intelligence, WhatsApp-based fact-checking, and she is the co-host of What's Crap on WhatsApp, an award-winning voice note fact-checking service. Her work also involves training African journalists on verification and research techniques. Kate also has a research interest, and her main research areas include education, immigration, crime, and viral social media hoaxes. In 2018, she discovered an error in the South African Police Service annual crime statistics, which led to an official revision. So we will start with our speakers, and should any of you have questions, please post them in the Q&A box and comments, and we'll look at that at the end. So I'll now hand over to Dinesh, who is our first speaker.
Thank you so much, Janus. Kelly, is my sound okay?
Yes, it's okay.
Thank you so much. Thank you everyone for joining us this afternoon. What a wonderful opportunity to speak to you all and to tell you a little bit about the work that we're doing at Wits Journalism. I'm going to focus more on the teaching of journalism and what we've been doing innovatively to convey all that we want to do in our program amidst the conditions of the lockdown. And then Kate, whom I work very closely with and who's based in our department, theoretically, not physically anymore, we'll talk more about the misinformation, disinformation aspect of the seminar today. So as Janus said, my name is Dinesh Bhalia, and I have run for many years the honors program at Wits Journalism, which is known as the Career Entry Program. At the heart of this program is a community newspaper known as the Vets, which is our training publication, otherwise known as what many of you will recognize as a teaching hospital. Journalism schools all over the world model this teaching hospital, this model which came out of the health sciences, in fact, to give our students a real world feel for journalism, its practice, and what it means. Our faculty then, obviously, myself included, operate not just as teachers and lecturers and mentors, but we're also editors and sub-editors along the way. The career entry program looks for graduates in all faculties. Our center has taken the deliberate approach of making sure that we don't do undergraduate teaching. And the very specific reason for that is simply because we want people who come from law, people who come from commerce, people who come from science and engineering, who have a good knowledge of those fields, and then to combine that with journalism in order to chart a way forward in their careers. And we often tell our classes, when they start at the beginning of the year, if you want an easy degree, then please find yourself a medicine degree, because it's certainly not an easy program that we have. But the long story here is that we have a very mixed bag of students coming from a diversity of undergraduate degrees, but also, their social backgrounds, their social circumstances, and their living circumstances actually vary from person to person. I will say that the pandemic has not been any kinder to us than it has been to any of you. From March last year, we shifted to what the university has been calling remote online teaching. But for many of you, for us, like many of you in the health sciences, the impact has been far greater than the kind of average student in the average theoretical program. Our students left the campus in March last year. They headed home. But just 2 weeks later, while most students across the country were waiting for news of how to continue their studies, the Vuvuzela newsroom kicked into gear again. We came online because we were not about to miss the biggest story of many of our lives, actually. But with this came the reality, obviously, of not being in our community and in our safe space. As many of you know, when our students walk through the doors at our university, it evens out the playing field. It makes certain that the students have access to the same resources, the same network quality, the same camera equipment. They're able to communicate with each other in their own languages, and so on and so forth. But at home, we can't guarantee that any of those things hold true anymore. And on top of that, we have the added layer of not being able to ensure that their home learning environments are conducive, or that they're actually safe. So, when you're sending your students away from the campus, you've got a scenario where you need to be thinking about very many things that you cannot think about when they're on campus itself. In terms of the curriculum, we were clear that we were going to find ways to meet our learning outcomes and to ensure that they were the same quality as it would have been in previous years. So initially, we devised assignments and tasks that focused on the home and the student. And it may sound easy enough, but the one thing journalists don't like doing is talking about themselves. And of course, the irony here is that we spend our lives saying that journalists should not be the story, and that they should keep a critical distance from those that they are writing about. And here we were in journalism studies telling our students to write about themselves and write about their families, because we needed to find a way to deal with the very hard lockdown scenario where we had no one else to turn to. We had no people. And what is journalism if not about the people? So, we've always used formative assessments in our work. So assessment was not really an issue for us with online learning, but we needed to find ways to work within those lockdown regulations. We used MS Teams initially to have ongoing, teaching and lecturing and mentoring. So even working on sub-editing of a story with a student meant that we would have a call with them, we would see their faces, we would engage with them. But as teachers, it meant that we could not gauge a student's discomfort with the story. So often when we work closely with a student in a mentoring scenario, we can tell when they're uncomfortable with something. So for example, often we have sexual assault stories that a student is dealing with, and they have not disclosed to us that they may have had an incident in the past or may have had experience through family members, which is traumatizing for them or triggering for them. As teachers, that closeness of working together means that we're able to pick that up and pull them off a story without having to force them into a situation of disclosing or resolving the issue. That's not the purpose of of mentoring, but it is to protect our students, to make sure that they're comfortable with the work that they're doing. So we lost a lot of that in terms of working online. We did simple things like switching from video production to podcasting, which worked remarkably well. So we had students who were recording little voice notes on WhatsApp and sharing them with each other and eventually using the online system to compile their podcasts. We also encouraged them to talk about their mental health challenges during that time using the podcast. So while we were busy teaching the technicalities of podcasting, we were also allowing the students to engage with one another and with their peers around a topic that they would find difficult to engage with inside the classroom. So that was a big positive for us. Asking our students to work with their home communities meant that they had the opportunity to meet people face-to-face with social distancing, to verify their identities and their stories. I mean, this was critical for us. You can't just engage with someone that you've never met before via WhatsApp and be able to verify the facts of that story only on WhatsApp. So once we went into the second wave and the lockdown regulations became a little softer, we encouraged the students to work inside their communities, get to know people, walk around. And we had some fantastic things happen. We had people who were at a clinic in a line that was too long, looking for assistance, and they would WhatsApp a student to say, come and have a look, and a story would emerge out of that. But then, of course, we had to do certain things like teach our students how to be ethical in terms of video reporting, right? If I'm sitting here interviewing a Kate Wilkinson, the very fact that she is zooming in from her lounge or bedroom or whatever it was didn't mean that I have the right to write about that lounge or bedroom or whatever it was. So we had to kind of think about new things that would emerge during the process of doing this journalism. The lack of face-to-face interviewing meant that our students could not rely on cues like body language to ask the right questions. And I know many of you will understand this in terms of bedside manner, right? You rely very often on what you see and how people react to questions. So it became difficult for our students to ask the right questions. So we had to engage in the process of teaching them how to look for other kinds of cues that are, from the chest up and so on and so forth. But of course, the biggest loss to the students was just not having their peers with them, the ability to turn to the side, to the right or the left, ask a colleague in the classroom to reiterate, to repeat, to reinforce a lesson. Ultimately, this placed quite a heavy burden on the academic staff, who would then have to repeat things individually to a class of 30 students at times. But of course, it wasn't the worst scenario, but it was quite a draining scenario on the staff. One of the few ways in which our curriculum did change was to the introduction of new classes that focused on understanding the language of the pandemic and ensuring that our students were equipped enough to read scientific research. I mean, I myself was delving into medical journals that I've never heard of in my life. And then, of course, you have to establish the credibility of some of those journals, as I've learned, and to understand what they were writing about to the point where you could write about it, right? As the editor, I myself compiled a WhatsApp group. I brought together a bunch of my medical friends, doctors, scientists, people working at the NICD, so that along the way, if I was stuck as the editor, I could turn to them as the experts to ask them to even do things like read how a particular sentence was phrased. Because language became so crucial in communicating the correct information around this pandemic. And we needed to realize in the newsroom that journalists are not the experts, right? They're the in-between. We need to try and get as much as we can out of the experts, understand it to a point where we can convey the information in a very digestible way. The facts change so often during this pandemic. 1 minute is, and I hate this word, aerosolized. You'll have to say it for me, Kate. I learned about droplet size. I learned about all sorts of things. And every single day there was something new coming out. And it was impossible for journalists to keep track of this. Quite frankly, you needed to turn to people who had their finger on the pulse of all of these different kinds of issues. So one of the biggest lessons out of this was really that journalism is more collaborative than we think. That we must be able to and feel like we're able to turn to experts and specialists and scientists within our community in order to get it right. That we're not alone. And I was gobsmacked by the level of willingness that people exhibited in wanting to assist with the communication of this information. We also hosted many guest speakers, down to Professor Abdul Karim, who was chair of the MAC at that point, who felt it important enough to make an appearance to these young students to drive home the point of the response, the weight of the responsibility that they carried. And I had to have a very deliberate discussion with the students in my newsroom about where we stood on scientific facts, where we stood on things like vaccine hesitancy. Even though we may have had one or two people in the newsroom, what was the newsroom's voice? What is the message that we were going to put out as a newsroom? And that had to be something that we negotiated, but it was a discussion that needed to happen ultimately. I won't be much longer. One of the advantages of working away from our newsroom, though, was that we managed to diversify the voices in our publication. During the second wave, we had students based in Khayelitsha, which was one of the hotbeds in the Cape. We had a student based in Eswatini, and we had students all over the country. I'm very proud to say that we were the first in the country to shed light on the COVID situation in Eswatini, and to talk about the stories of many of the nurses who actually carried the burden of patient care in that country for a long time when denialism was rife. And we also told the distressing story of a man in one of the local communities in South Africa who was taken away in an ambulance for a COVID test, when we were being rather dramatic right at the beginning. If someone had a cough, an ambulance would come and take it away. And after that, never recovered his life because he was vilified and ostracized in his community to the point where he developed anxiety and depression. And that was, an aspect of the pandemic that we haven't fully explored. What people who are living with stigma are continuing to encounter. And then we did a fantastic story that explored grief in the time of the pandemic, not just from the perspective of families, but also from the perspective of the funeral parlor workers who have to console families in that moment. So we've had many opportunities, and done some fantastic work, but through it all, it was for me a learning process and understanding that the journalism we're doing is far more collaborative than we thought before. Often you'd hear people say when you're working on a story, you're working by yourself, and it's very isolating. And the second biggest lesson that I learned out of this was that our practice is not bound by the walls of the newsroom, that we can do it wherever we are. And that was probably a very big lesson that applies not only to journalism, but to many of us across the university. Thanks, Janice. I'll stop there.
Thank you so much. Thanks, Dinesh, for your insight and for sharing your challenges and also the interesting approaches and ideas that came out from your experiences. So I think two lessons from what you mentioned that stands out for me is the one thing that you mentioned about the credibility of journals, that I think there's so much, that came out, and that as academics, I certainly don't always check the credibility of journals. And then the other thing, I think what you mentioned around, shaping discourse and the use of language, I think that is, something that is very important. And just from my own experience, I think you also alluded to that, is collaboration. And I think the one thing for me from the pandemic that came out is like there's a lot more collaboration across spaces. And I think one of the reasons is it's with the fact that we're using technology or Teams and Zoom and so forth, collaboration has become a bit easier. I will now hand over to Kate for her to share her experiences.
Thank you so much, Yanis, and hello to everyone. I thought I'd say hi quickly so you can see my face and what I look like before I share my slides with you. So let me get that going. As Yanis has introduced us both, my name is Kate Wilkinson and I'm the Deputy Chief Editor at Africa Check. For those of you who don't know who we are a fact-checking organization. And when we were founded in 2012, we were the first one in Africa. I'm pleased to say that that is no longer the case. There are a number of amazing fact-checking organizations in many different countries doing this important work. We have teams though working in South Africa, Nigeria, Senegal, and Kenya. And when we were first founded, we were in South Africa and we were based in the WITS journalism department. And that still is our home. And it was a very important place for us to start and to base our organizations for a couple of reasons. One, we want to be where journalists are learning how to become journalists because we want to help them learn about how important fact-checking is. But two, although we are lucky in South Africa, in some of the countries where we work, universities actually offer us protection and the space to do our work in an environment which is protected because of the academia. And that can be important when there are government or pressures that are applied on this sort of work. So very quick explanation. We look at things which are said in the public domain, whether it's a president, a politician, an influencer, a billboard, which has an assertion of fact, and we determine if it is true or false based on publicly available information that is recent, reliable, as well as expert comment and analysis, so that we make sure what we're reading, we understand, and we can explain properly. And these are generally published on our websites in the form of reports, but we carry a whole host of other kind of content. So that's guides for journalists and the public, fact sheets on complicated issues to make them easier to understand, blogs from experts exploring statistical issues. And we also offer training to newsrooms and media professionals and increasingly civil society organizations to help them make sure that the information is shared is accurate and that it is evidence-based. And importantly, we are a signatory of the International Fact-Checking Network's Code of Principles, which means that we ensure that we're nonpartisan and we're fair in our work, as well as being transparent about our sources, funding, methodology, and correcting openly and honestly when we get things wrong. So, you know, the main question that was sort of asked when we discussed this, this discussion was, you know, has the pandemic changed your work, or how has it? And I think that everyone here can attest to the enormous changes that we've all experienced personally, in society, in our professions. But we've really been able to follow the development of false and misleading information around the pandemic right from the beginning. I remember the day very vividly. It was in early February 2020 when someone on WhatsApp sent us our first bit of false information or misleading information around COVID. And you can see it on the top right-hand corner there. It's a picture of a back of a Dettol surface spray. And it says, you know, it can kill, it lists a whole lot of things, influenza, etc. And then it says coronavirus. And this was sort of the first example of the type of false information we saw around the pandemic, that it had existed, it was around. People were lying to us that it was new. Some people had been prepared. Obviously, Dettol had been told about it, and they were able to produce all of these surface sprays, and they were going to make a killing off the virus. And I remember we assigned this to my former colleague, Kaylee Clifford, and she fact-checked this. And we just could never have imagined that 2 years later, it would still pretty much be consuming most, if not all, of our time, resources, and energy. And we have pretty much pivoted most of our work towards combating misinformation around the pandemic. And that has spread from claims about the origins of the virus, the fact that it has existed and that it's not new, as many people claim. We also, if you see in the bottom left-hand corner, had to fight back against a very pernicious and dangerous piece of false information that was widely shared online, claiming that Black people or people of African descent were immune to the virus and that they couldn't catch it, or if they caught it, they would somehow heal themselves. And we worked with a number of medical and public health experts who were very worried about this piece of false information because of the impact it could have, leading to certain sectors of society not thinking they had to take preventative measures, such as hand washing or social distancing, and potentially exposing themselves to more risk. But there've also been a wide range of different types of false information, and some of these have had a monetary motive. People are trying to make money off of this. We've seen, you can see in the bottom right-hand corner, a video that we fact-checked, which was viewed over 2.3 million times on Facebook by a company called Oxygen Products, which claimed that its supplement Mega Oxygen would boost oxygen levels in your blood and either prevent you from catching COVID, or if you had it, it would cure you. And it had a whole host of testimonials from people who very genuinely believed that it had cured them. But when we spoke to doctors and medical experts, they were horrified and said, well, Mega Oxygen is really just magnesium peroxide. It's an antiseptic, it's a bleaching agent. We wouldn't recommend anyone takes it, and it could actually be quite dangerous depending on what other medication you're taking. And then lastly, we've seen another way that people are trying to make money off the pandemic, and that is to falsely advertise either government grants to support people or job opportunities for people who have lost employment or income because of the pandemic. And they always include, a small application fee. And these scam networks can be so advanced and so broad and sophisticated that thousands, if not tens or hundreds of thousands of people view them, fall for them, and through small contributions actually make these very bad actors quite a lot of money. So what have we done? So the problem that we're facing is in some ways old. False information, propaganda, and misleading information is as old as we are. But it is spreading and being shared in a new way. It has a much bigger reach than before. It travels much faster. So although this problem is something we as fact checkers have been dealing with now, at Africa Check since 2012, we have some tried and tested ways to combat it, which we do, and we've continued to work into our day-to-day work. But importantly, we have to find new approaches to combat these problems. So the first approach really is informed by this idea that we want to meet people where they are. When we first started our work, we publish on our website, our reports are very detailed, hyperlinked, we cite sources, everything is explained, and they're probably 1,000 words long. And quite a few people read them, but they're not going to be appealing to probably the vast majority of people in South Africa or Kenya or Nigeria. So what we also do is we go where people are, and increasingly that's on WhatsApp. And we produce our work in a format that they consume and they create themselves. And increasingly that's a voice note. So we have a show called What's Crap on WhatsApp. It's like a fact-checking service. You save our number on your phone, it's there, and you send us a message to sign up. And then when you get a piece of false information on WhatsApp, you don't need to save it and find our email address and email it to us. You just forward it to us. We log and catalog every submission that we get. And then twice a month, we review those submissions to find either the most popular or the most dangerous messages which have been shared in the last 2 weeks. And we produce a podcast essentially, but we distribute it as a voice note. So that lets us reach a wider audience, and also an audience who isn't accessing podcasting content, probably because of maybe their smartphone capabilities, their skills, their understanding, and also data costs, because a voice note is very cheap and easy to send. So that's one approach that we've taken, and you can see how it looks when it lands in your WhatsApp on the right. The question is, though, does it work? And as with many interventions like this and a lot of fact-checking work, the answer is we're not sure, but we're trying to figure it out. And part of that is we're undertaking a randomized control trial. It's almost been going for a year now, where with our sample of almost 10,000 people are going through an intervention, and they're being surveyed at different points. And what we're trying to determine is if an intervention like this on WhatsApp actually results in belief and behavior change. And we hope by the beginning of next year, we'll have some results, and we'll be able to share those along with recommendations for WhatsApp about what they can do to combat false information. Then we have our artificial intelligence work, and we've been doing that with Google support, financial support from them, but also expertise from their AI and machine learning experts to build tools that make fact checkers work faster and more efficient. It will never replace fact checkers. We still need a human to think, to understand, to speak to experts, to weigh different opinions. But there's a lot of our work which is very low skilled, repetitive, and takes a lot of time. For example, looking for factual claims to fact check. We have a tool which can scrape 20 websites and extract every factual claim. And then one person can just review those and determine what needs to be fact checked. That would take someone a day previously, and now it can take someone a couple of hours. And then lastly, we're also looking at being proactive as well as reactive in our work. Our reactive work is fact checking. Someone says something false, we identify it, we fact check it, we write a report, we disseminate it. But you're always on the back foot. You're always trying to chase after that falsehood. What we want to do is we want to have complementary proactive work. And increasingly that looks like media literacy campaigns, often in voice notes. So we have done these campaigns in the countries where we work in English, but then also in a widely spoken local language. So that's isiZulu in South Africa, Kiswahili in Kenya, Pidgin in Nigeria, and Wolof in Senegal. And we've seen an amazing response because people are being spoken to in the language that they speak to their family and friends in. They're not having to read a long report or even listen to English. It's something that is very familiar to them. and it brings them much more into an engagement with you on these very important topics. We've also launched a fact ambassador program. So that is getting nominations of people from all walks of life, doctors, teachers, professionals, community leaders, who are seen to stand up for the facts and accurate information, and then interviewing them, selecting them, giving them training, giving them materials and support so that they can sort of preach the gospel of fact-checking in their communities, but also disseminate information into networks we're not getting into. And then lastly, to wind up, we're also very shortly launching a comedy campaign, which again is trying to reach different people in different ways, because we know we have to keep evolving and we have to do more if we want to help people stay on the right side of the facts. So very quickly, if you want to help in any way, please visit our website, share our work, send us claims to fact check. You have an eye and an ear for things, and you can pick up a red flag that we can't see. So please let us know where something needs to be interrogated. Help us fact check. If you want to be an expert who helps and gives comment, we're always so happy to have you. And then if you need training or research services, or you know organizations that would benefit from this sort of expertise, please get in touch. We'd be very happy to have that discussion. And thank you so much. I'm looking forward to the questions and the discussion. Thanks, Janis.
Thanks, Kate. That was really interesting, especially the What's Crap on WhatsApp project and how you use AI. I think that, yeah, that's such an innovative approach. So as I have you on the line, I actually was and have the privilege to ask the first question. I'm going to do so. The one thing that interests me is how many people follow you on What's Crap on WhatsApp? Is it already quite a wide community?
So yeah, so we actually started What's Crap on WhatsApp in 2019. And it was actually the brainchild of my colleague, Paul McNally, who has a podcasting company called Volume. And he had this idea about trying to come up with a solution to the fact that podcasting is huge in America and Europe, and it's an amazing way to disseminate information, but we don't have the podcasting penetration in Africa that other countries do. And he just thought it was such a missed opportunity, and that there was an audience for this audio content, but they just didn't have a way to connect with them. So he said, why don't we just, use WhatsApp? It's widely used. Everyone knows how to send and receive a voice note. So we'll just make the podcast a voice note. And we kicked it off. We sort of said we were doing it on Twitter, and it absolutely exploded. And we were pretty much forced by the demand and expectation of people to create it within about 3 weeks. And over the first year, we had about 1,000 people sign up. But the real growth came during the pandemic. We now have around 6,000 people in South Africa who are subscribers to What's Crap and WhatsApp. And that's just that on that line. We also have another WhatsApp line in South Africa, as well as WhatsApp lines in our 3 other countries. So we have around 11,000 people in all our countries on WhatsApp. WhatsApp and the broadcast function is amazing. You can do so much with it. And it's a big part of our approach to disseminating information now. The only drawback is that you have to use the business app. And it's very good and very manageable with small numbers. But during the pandemic, we all worked at home. So we had the WhatsApp person with the phone. She took it home. And some days during the pandemic, she'd wake up with 800 messages on WhatsApp. And that was people forwarding us content, which she had to log manually, asking us to fact check things, asking to subscribe. And it is a beast if it is big. So great to start quickly, very effective, but it can grow and get out of control if your numbers increase too much.
Thank you. That's very interesting. I see Anya asked a question to Dinesh regarding the changing ethics environment. Did you or your department engage and consult an ethicist? If not, why not?
Yeah, so we have in-house a professor of ethics, of journalistic ethics, and we operate as a collective where there are these kinds of issues that crop up. We also subscribe to the Press Council's Code of Ethics, which means that we are held to account for any transgressions. But I do have to acknowledge that given the crisis in journalistic ethics in the country in the last couple of years, We've taken a decision as a department now to put together a whole new course, actually, that focuses on journalistic ethics, and especially given, you know, collaborative work that we're doing that involves people's, you know, more sensitive issues now. There is clearly a need for us to retrain, to rethink and reconfigure how we approach ethics in the work that we're doing. Thank you for that question, though. Jonas?
Thank you. So I see there's a question to Kate. What are the legal implications for spreading misinformation? Or I think this is a good question. Where the intent is monetary gain. Is your organization often called to court to testify?
Sorry, I was muted. A great question. So, you know, we did see through the Disaster Management Act sort of an emphasis on implications for deliberately sharing and spreading false information. Broadly on that topic, Africa Check doesn't support the criminalization of sharing of false information in the most part. And that's because largely people who share it don't realize what they're doing. And often they have very good intentions and they want to help people. So when it comes to the issue of monetary gain, I'm not entirely sure, I'm not a lawyer, but I would imagine that someone who was scammed in this way may be able to have recourse, but often these people are anonymous. We did a big investigation with Jean Leroux from the Atlantic Council's Digital Forensic Lab. And we actually tracked down the owner of one of these scams who was managing it to his house in Limpopo. We figured out to get comment from him and put all these allegations to him, and he didn't respond to us. So we didn't name him. We couldn't take that risk ourselves of naming someone without those sort of assurances. So unfortunately, I think there is very little legal repercussions, even for scammers, to spread misinformation at a higher level. And I think what it comes down to is we need societal pressure and we need public pushback so that those people feel the weight of their actions. We haven't been called to testify in court yet. That sounds like a horrifying concept. But you know, all of our information is publicly available. So, you know, you never know what will happen.
Thank you. I see there's another question directed to you. How do I access Africa Check training?
Okay, so that is, there are a few ways you can do it. Africa Check does presentations on our work like this. We can come and share work that we've done on health or on economic false information. But we also offer training where you can have Africa Check expertise as training for your organization. So that will be in fact-checking, verification, understanding scientific studies, writing science press releases, which I think is such an important thing, which is often very poorly done and leads to very poor science reporting in general. So drop us an email. You can email us at info, I'll respond there, info@Africa Check, and let's have a discussion.
Thanks. I've got another question for you about you, and it's to both of you. So firstly, maybe you speak about the what you exactly do, how around the media literacy campaigns, but then maybe about to both of you about how one can approach a media literacy campaign to not around misinformation or not spreading misinformation.
Sorry, is that question for me first, Giannis?
Yes. So you can speak to what does your media literacy campaign entail, and then maybe more broadly around what should it entail, so how to go about it. So
I think the starting point really has to be you have to step away from the assumption that you know what is needed. It's very easy working in this space, either being a journalist or media practitioner or a fact checker, to think, oh, this is why people are getting it wrong. But actually, often from our training sessions, going to train newsrooms, to train increasingly students now, members of the public, you're actually able to see some of the problems that people are encountering. Media literacy is not like a band-aid for the problems that we're facing. It's really just one tool in our arsenal. And I think a few of the things that you need to consider is helping people become more aware of the flood of information which they are receiving on a daily, if not like every moment basis. There is seldom a moment where someone is not messaging us, calling us, we're getting an email, there's a Slack message, that people have become numb to the quality of information that they receive, and they are blinded to red flags that probably if they had more time to consider and think, they would spot. So helping people and reminding people of those red flags, teaching them basic tools, online tools such as Google reverse image search, TinEye, just how to search Google to find out if something did or didn't happen. These are very basic things that often people don't even think they're capable of doing. But if you show them a couple times and give them that confidence, they can actually do quite a lot for themselves. Dinesh?
Thanks, Kate. Media literacy has taken on a kind of global shift in that we recognize the need for it. But quite frankly, the need for media literacy is tied up with literacy generally, the ability to read, the ability to critically analyze content, and to be able to make decisions about whether you should share or not share. I think you're right, absolutely right, Kate, in that we are faced with a flurry of information on a daily basis. And really the point is that we need to understand more what our responsibility is in relation to that information. Who do we share it with? Why are we sharing it? I read an interesting piece of research this morning on Nieman Labs saying that, yeah, there are people who are sharing this information, and then there are people who will only share facts, but there are also people who are sharing information that says, and they labeled it, they said, interesting if true. So really, these are individuals who, they're finding things curious, they're engaging, they're reading, right? They're consuming media. And they're making a decision as to whether to share that, and they're kind of putting in a disclaimer that they don't quite understand. And so this landscape of what is misinformation and fact is actually changing before our eyes. In terms of what we can do in terms of media literacy, is we need to start, I think, and this is my personal perspective, integrating discussions about media in everything we do. And I, again, not to bring in the research that I've read, but I read a piece the other day, and I think it was on Atlantic, about how media communication and what people are reading is impacting on whether people seek healthcare. And this is critical for those of us in healthcare, because we need to understand what are the factors that are prohibiting people from seeking out care, or what are the factors from people seeking out care that is not appropriate. And that is not, strictly speaking, a misinformation perspective, right? That's a media literacy issue. So I do think, Kate, as you're saying, it's a bit of a buzzword. It is a word that we haven't quite managed to unpack clearly. But I think this is a project that we need to be integrating more closely at a younger age with people in schools, and also bringing it into our undergraduate degrees at universities across the board, not just in the Faculty of Humanities. Jonas?
Thanks, Dinesh. I fully agree with you about bringing it in earlier, because it's definitely a 21st century skill. And as we're plagued with so much information, I think it's critical to be able to navigate media. Kate, there was a question for you. Do you have an example of proactive journalism through the campaigns you mentioned?
Yes, and I think this is actually a great opportunity, a question to give an example, but also to show why it can often be more effective than the fact checking. So something that we've had to counter quite a lot is this belief widely spread, especially in certain communities in South Africa, that COVID-19 is actually caused by 5G. And we have seen instances, not just in South Africa, but globally, of cell phone towers being burnt down, protests against 5G. And we have pushed back and fact-checked content on that claim and that topic. But what has been incredibly effective has been a proactive fact sheet on the topic, which explains exactly what 5G is in very simple language, how it works, what it's used for, but is completely removed from any claim or assertion. And that can be incredibly important for someone who is polarized on a topic. If someone believes that 5G does cause COVID and they open a fact sheet or fact check, and the headline is 5G does not cause COVID, they're not going to engage with that content, or they're going to shut down immediately. They're going to say, this isn't right, I can't trust the source. But if on your website, which also says 5G does not cause COVID, you have a fact sheet which people are Googling for and finding, and it very simply just explains the basics of it, what it is, what it does, how it was invented, that gives them knowledge that they probably don't have, and then hopefully will equip them better to interrogate their own beliefs and what other people are saying. So that is, a very long, almost 2,000 word fact sheet on our website, but it was also a 3-minute long voice note, which was distributed to our media literacy communities in the 4 countries where we work. And we do that on a range of issues. Another one, we have a very simple fact sheet on how vaccines are approved in all the countries we work. Because that's very important information that has become very twisted and misrepresented because of certain actors and communities in our countries.
Thank you. Dinesh, there's a question for you. How does a proactive approach in media studies shift the way that we train students? So drawing a parallel to preventative medicine and primary health care, where prevention is better than cure. But we know that bad news sells. Does shifting the narrative allow us to change perceptions and behaviors?
This is a tough one. This is a really tough one because it speaks to what the media considers to be the public interest versus what the public is interested in. And it's one of those debates that's ongoing in order to try and fix, media sustainability and whether people will support media in the long term. And people are completely right. Stephen, I think you made the comment, if it bleeds, it leads. And that's something that has shifted over the years, particularly because we've moved to online news. And so we don't have the prominence of the print newspaper, right? It doesn't have to lead. It can be placed on anywhere on a website and still gain prominence. So that's shifted a little bit. I think what you mean in terms of proactive approach, in terms of media studies, is to just be a little bit more balanced. So, for example, when we are reporting on debates around ivermectin, for example, we are always ending that text with the scientific facts around it and where we are currently in terms of what the experts are recommended. And we, again, we have to justify why we've chosen a certain group of experts. And for me, that is the proactive approach, where we talk about people taking their own lives, for example. We do have to bring in discussions about anxiety and depression, and not just that, it's an empty news report about someone jumping off a building and that was the end of that. So we're trying to shift the narrative in that way, and that we're also looking out for what is in the public interest still, despite people pushing us to think about what interests the public. So I think that's really where this debate lies. I'm not sure I have a firm answer for you. This is an ongoing, a game almost. Try it out and see where we go and see what works and so on and so forth. And at the back of this is always this discussion about what will make you money. Unfortunately, likes don't feed journalists. We need to pay people to do this work. We need to feed families to do this work. So it's a difficult one for me to answer.
Thanks for that. There's another question to Kate, but I think I'm also going to open it up to both of you. So in your views, and Kate, you can answer first. In your views, do you believe social media companies did enough to address misinformation on their platforms? How could they have done more?
The short answer is no. Depending on the social media platform, they are all trying different things. So we are part of Facebook's third-party fact-checking program. So we are paid by Facebook for a service that we provide, where we fact-check posts on the platform that are flagged as potentially false. And if we fact-check them, publish a report in which they are found to be false, we can rate that content, and users who interact with that content will see a warning. But the flood of false information on these platforms is so enormous. It is so immense. There will never be enough fact checkers. You couldn't have a factory of fact checkers to work on it. The problem is a structural problem. It's how these social media platforms are designed to operate. You know, an example that I saw a colleague in Nigeria sharing this week is that there are elections in 2 Nigerian states this week. And on Twitter in England at the moment, you can report a tweet. And one of the things you can report is, and I'm reading from her tweet here, this is misleading about voting. And that's available in England. In Nigeria, when you follow the exact same steps, that option is not available. The only thing you can say is, I'm not interested, it's suspicious or spam, it's abusive or harmful, and it expresses intentions of self-harm. In Nigeria, you can't flag a tweet as misleading about voting, something that you can do easily in the United Kingdom. Why is that? Why are Nigerians not able to take that same step and to be part of solving this problem? So I think they can do much more. And I think part of that involves fact checkers, it involves, you know, discussions with government, public policy experts, but it's an ongoing problem. And I don't think we're anywhere near to a solution at the moment.
Dinesh, anything you wanted to add, or?
No, I think I'm covered there.
Okay, cool.
I think we have a few more questions, Eunice.
Yeah, so there's one for you, Dinesh, around, can you elaborate more on shaping discourse and the use of language with a few examples, please?
Yeah, I mean, language is critically important. And, you know, we live in a country where language is very loaded. The simple things we say carry weight, it carries historical context. And so we have to be very reflective on the kind of language we use. To give you a simple example, you know, the term anti-vaxxer has become very weaponized actually on social media, in that it's used to ostracize people. It's used to, you know, put people in one silo. And quite frankly, that's not the case with every person who chooses not to have a vaccine at this point. They have this you know, conspiracy theory in their heads about what the government is putting into their bodies and so on and so forth. And so we would choose, for example, to say that there's vaccine hesitancy or a person who has vaccine hesitancy. And when we do that, what we're doing is we're allowing space for someone to be educated otherwise. We're saying that there are still people who can be convinced through the information that we're providing, and that we would provide factual information or a discussion in order to get them to that point. So, you know, I find the word anti-vaxxer very hard. It's a wall. It's something that we can't get through and they can't get through. Whereas the word vaccine, or the words vaccine hesitancy, opens up a discourse. And so I think that's where, you know, you want to be able to think about your language very, very carefully. Another example is the UK's red list. You know, red is about a hotspot. Red is a dangerous zone. And quite frankly, South Africa was on this red list for the longest of times when statistically it made no sense. And we would bandy this term about without actually unpacking the fact that there were other motivations or agendas behind this so-called red list. And many, you know, newspapers abroad were using the term willy-nilly. So it's important for us to unpack those things and to be able to justify why we're using them, and to not just simply use the labels that are attached to it, you know, for political gain sometimes. Kate, I don't know if you want to add anything there.
No, I think you nailed it. And I think it's actually linked to how, like I said earlier, how polarizing takes can be, and that trying to bring people into a critical, engaging way of thinking requires you to be more welcoming than sometimes you feel you should be, especially when the topic is so important like that of health and COVID-19.
So just on something about what you said around language, I was having a good discussion with one of my colleagues in family medicine, and she was talking about that we need to meet people where they are at in terms of vaccine hesitancy. And I think what you mentioned about, you know, using strong language and so forth, is it is going to put up barriers, and you won't be able to have those open and honest conversations. Kate, there's a question for you. Does Africa Check offer critical and insightful tools on reporting? As we all love positive stories, but there's sometimes more than meets the eye.
Yeah, I think I can see Dinesh smiling because she's thinking the exact same story I am. Just before we all jumped onto this discussion, we were talking about the press release where there was meant to be the moment of truth when the Tembisa 10 babies that were going to be revealed. And now it turns out the story has just sort of gone to even further depths. Apparently there were a certain number of babies and they've been trafficked and government was involved in a huge conspiracy. And there just seems no end to this ridiculous, in all probably likelihoods, completely false story. And I think what's interesting is the use of the word tools, critical and insightful tools. The hardest thing that I have to often tell people when I do fact-checking training is they say, okay, what tool can I use? Where's the website? I can put this claim in there or this picture and it's going to tell me this is true or false. And actually, I have to break the news to them. No, actually, you have to do some really hard work of changing how you think. And I can't make that happen for you, and you need to take the steps. All of our work is really aiming to achieve this, whether it's a story about 10 babies being born, whether it's claims that were circulated about how many hospital beds were taken up by alcohol-related injuries. We need to help people understand that information isn't what they often think it is. It can be true, it can be false, and often the best tip you can tell someone is just find the source of that information. If you can't find the source of that information, that's probably a good indication of whether you should trust it or not.
Thanks for that. Dinesh, I loved your discussion around opening up spaces for students to build their sense of self by building on their own resources within communities they come from. What are the inherent risks for students who are still learning and are likely to make mistakes?
Thank you for that. It's a really important question, and I know, in the health sciences particularly, it's a really important question in terms of the risk that's involved, level of risk that's involved. For us, we consider ourselves kind of like helicopter lecturers, actually, because we're ever present with our students, even if it's via WhatsApp. We are in constant communication, even to the extent of a student who wants to take a photograph of a particular situation will text on WhatsApp to say, I want to take this photograph. I'm standing outside. I'm at a hospital. There are patients. How do I take the picture? So we're guiding them and mentoring them very, very closely, especially when they are away from the newsroom. Excuse me. Because it's not just about the risk to the student, it's about the well-being and the safety of the people who are reported on. And it's our responsibility to make sure that the rights and responsibilities of patients, of individuals out in the public, and so on and so forth, always respected by the students that we're putting into the field. So it's balancing those rights, and we do that by just maintaining a very close communication system with the students. If we need to take a WhatsApp after 9 p.m., 10 p.m., 11 p.m., it happens. And it is exhausting, but it is the nature of a professional program after all.
Thank you so much. So thank you very much for all your questions, and to Kate and Dinesh for joining us and sharing your ideas and opinions and the challenges that you've experienced in this space. So misinformation has really sparked us in the Department of Family Medicine as well to think about a short course on that we can offer on how to deal misinformation in health. And how to fact check. But at the moment, I can just say watch the space because it's a discussion. Please join us for next week's session on mental health and fragility, lessons learned during HIV and COVID. And if you missed a recording or would like to see additional resources on the topics, please visit our website, Wits Where To. And you can also add us to Instagram and join the conversation there. So that is DFMPC at Wits. And yeah, we hope you have a good afternoon. See you next week.
Thank you so much, Janice.
Thank you so much. Bye, everyone.
Cheers, everyone.
Bye, everyone. Well done.